Thanks a lot, Connor. Well, having a comfortable nest egg for retirement, well, that's a goal of all Americans. But with 401ks and other retirement vehicles still trying to recover from last year's market meltdown, planning ahead is tougher than ever. Here with some tips on how to make the golden years golden is Dr. Eva Mor. Welcome to the show. You know, we all know we're going to get old, and yet it seems like we all have this hard time even having this conversation. How does a family or a person have this conversation with the relative on planning for this, you know, as they enter their senior years?
I think first of all, we need to realize ourselves that we need to prepare for the elder years. Then we can cope with our parents aging and our
So in other words, we should be realistic and do it ourselves for ourselves, and then we can help someone else.
Yeah, I mean, it can go both ways at the same time. But I don't think we prepare ourselves ahead of time. We prepare ourselves for vacation much more extensively than for our retirement. So we'll prepare for our parents aging, how to deal with issues as they come up, or our own aging.
Well, on that note, what's the #1 thing that people should be prepared for?
Well, I think if it's for ourselves and we're young enough, we should put in place long-term care insurance, which very many of us don't do because we think it's too expensive. But if we do it early enough, it's not that expensive, and it protects our assets later on. As you age, it's too late to
Dr. Mor, the thing is, though, there's so many commercials and there's so many people, and you always pick up the newspaper and see where elderly people have been sort of ripped off. How do they know the scams from the real things? How do they even avoid those traps?
We all scams. We lost last year around $50 billion to
$50 billion.
And a third of it is said to be by the aging population. I think it's much more the aging population at times doesn't know that they've been scammed, or they don't report it because they think it's their fault. I think the law should step in much stronger, and our information should not be free to be purchased by anybody. If the data is out there flooding, then anybody can step in and use that data against you or the elder.
Let's talk about the role of Medicaid, Medicare, Social Security. I think by now most people know that's not going to be enough. How do you plan to live in your elderly years in conjunction with those sort of programs?
Well, as it stands today, Medicare covers 80% of medical expenses, but 20% it can be very expensive. It's out of pocket for the elderly. So when you save and plan ahead, which you should do, you should take into account that 20% of all your medical expenses will be out of pocket. There is supplementary.
Do you have a number for that? What does that equal? 20%? Is that $1,000 a year, $5,000 a year? On average, I know it's different from each person.
We have 2 or 3 chronic illnesses when we reach 70. The expense will be in thousands, not in hundreds and not in 1,000. It will be in thousands,
right? Because
medication is expensive.
We've got a little less than a minute to go. Can you give some tips before we go? Some of the things that you think are very important that you highlight here and also on your website?
Yeah. All the information is on my website, which is Golden Years Golden. And the main things would be legally protect yourself, have a will, check it every 2-3 years, have a health proxy. That's important because otherwise, if you don't have one, then strangers will make medical decision for you. Have your house reviewed for safety issues, so you're safe in there, or your parent is safe in it. Introduce long-term insurance into your portfolio. Keep all your medical records. You're entitled to them. Have a copy of everything.
All right.
The drugs and so on.
And, of course, people will go to your website and pick up your book. I know I'm going to pick up a copy. Thank you very much
for having me.
Dr. Eva Mor. I really appreciate it.